We're at a point in the HIV AIDS epidemic where we're scaling up at the same time as funding is decreasing. We need to find innovative solutions to provide sustainable, strong systems by the government, support from the private sector so that the whole community is involved, as well as how do we finance this. Without this, we're never going to be able to reach an AIDS-free generation.
Abt has a unique vantage point in having worked in some of the most important countries that are slated for the PEPFAR transition.
Abt has implemented a number of activities in 10 PEPFAR transition countries to further expand access to HIV and AIDS treatment. For example, in Namibia, Abt, through its SHOPS project, achieved a global first. Namibia is the first country to cover voluntary male medical circumcision as an HIV preventable benefit through private health insurance. SHOPS worked with both the public as well as private sector to agree on a standardized rate for reimbursement. SHOPS trained private provider offering quality male circumcision and is also providing the supportive elements to be sure that this activity is sustained long after SHOPS project leaves Namibia.
We did an analysis of the sustainability of HIV/AIDS funding in Nigeria, in which we found that the government of Nigeria was only contributing 15% of the overall expenditure on HIV/AIDS in Nigeria, and that is not sustainable. Based on that work, the government of Nigeria committed to increasing its contribution from 15% to 50% to the HIV/AIDS response. So we are currently working with the National AIDS Coordinating Agency so that they can allocate more Nigerian money for HIV/AIDS in Nigeria.
Abt Associates is very good at figuring out ways to include the private sector. How do you finance the epidemic, and how do you provide strong, robust, quality access to HIV/AIDS care and treatment services? In Mozambique, Abt is working with USAID to scale up services in 3 provinces. To date, more than 200,000 clients are on treatment. 19,000 of those are children, and 3,000 health providers have been trained to provide HIV/AIDS services.
Providers are more thoroughly incorporated into a country's national HIV response. We're helping to make sure that the amazing achievements that have been funded and led by PEPFAR in partnership with country governments can continue to be sustained and not put into jeopardy in the future.
Abt's mission is to help people around the world. We are contributing to the global mission of having an AIDS-free generation.